It's safe to say that most people did not anticipate in mid-March just how long the stay-at-home advisory would last. With schools and non-essential businesses closed, kids and their parents are living in a new normal and facing a new level of anxiety, disappointment, and uncertainty. Carolee McGrath spoke with Alane Burgess, the clinic director for the Bestlife Outpatient Clinic run by the Mental Health Association, to learn more about their Tele-Well program.
I think what we continue to see is that we're still going every single day, day by day, with still, the uncertainty and the not knowing of when things are going to be returning back to normal. So certainly, as we await to hear Governor Baker's, reopening phases, what that's going to look like for individuals going back to work. We're also still having a lot of questions about what it's going to look like for, kids going back to school in the fall time. As I know that there's some local colleges, they've already made decisions to move their classes to online for the fall. So far, it seems like some of the high schools in the area are still planning on, going about opening in the fall. But there's just the uncertainty. As we know, a lot of things have unfortunately been canceled. There's questions about what other upcoming events may also be canceled. So we're just continuing to see, I just think, a lot of uncertainty and a lot of people just really, asking the questions of, how much longer can this potentially continue to go on for?
And I think that's a big question, certainly, that everybody has. But when you have that uncertainty, obviously that brings with it disappointment for all the things that have not happened or are going to be canceled, but also that increased anxiety and the continuing of that.
Yeah, absolutely. And especially I think because, summer is a time that people have a lot of things they traditionally will look forward to. So as we know, a lot of kids right now, they're unfortunately missing out on their graduation ceremonies, whether that be from the eighth grade or even kindergarten, into high school, into college. People that have, talked about plans for vacationing, in the summertime, that unfortunately also is, being put on hold or extended for folks as well.
Can you talk a little bit about the kids and the students in particular? Because I'm noticing just in our district, there's been a great push to really reach out to families and students to make sure that they are doing well as far as mental health issues, knowing that there's disappointment. And I'm sure all the districts are doing something similar. But there is that disappointment. There is that isolation. And kids are not getting together as they can't. But what are you thinking is going to happen as this continues to unfold?
So, like what I'm seeing is, some of the schools, they are pulling together to find out ways that they can get the kids together, for certain types of graduation ceremonies with still respecting, the social distancing guidelines that are being put in place right now. I know for kids like, wearing masks and being in certain areas, still going about business as usual, with maybe returning the books or certain graduation ceremonies. But right, I mean, it is a trying time because, as we're hearing a lot of the kids, talk about, I really miss my friends. And one of the things that I think most of us parents never expected to hear is, I actually really miss school. I miss my teachers. They're really, missing, I think, just their friends and the structure and their teachers and the things that they were used to when they were going to school on a daily basis. So certainly, being at home and then doing the homeschooling from home, well, a lot of parents are, doing dual roles because not only are they working full time from home, but they're also trying to have that balance of also being a teacher from home as well and responding, to the school's needs, to the emails. And if parents have children of various ages in different classes or different schools, there's just a lot more dynamic right now around, what feels comfortable and what's feeling that, this has kind of gone on longer than anybody could have anticipated preparing for it to have gone on for.
Is there something that parents in particular should be watching for as far as, kids being more anxious, either sleeping too late or not sleeping enough, being a little bit moody?
Yeah, all those things that you just mentioned. Anytime that you're noticing that there's a difference in your child's what I would call as the baseline behavior. So if you start noticing that children are becoming a lot more frustrated, if they're having less patience, if they're showing anger, if they're starting to isolate or withdraw potentially a lot more. And then sometimes, especially in the younger children, what you might actually find is a lot more clinginess, where they may actually be more concerned about if a parent's leaving the house for any particular reason. And especially for those, parents that are still going to work, that are on the front lines, children may be asking, well, why is my friend's parents home, but yet my mom or my dad has to go to work every single day? So anything that you would be noticing, with your child that is very different than what they would normally be responding to would always be the first steps toward that sign of maybe it's just time that we have a conversation and a discussion about what it is that they're thinking, what is it that they're feeling.
Tell us a little bit about, continuing therapy if your family or your child has been in therapy, and how you've been able to facilitate that through the clinic with Tele-Well.
Yeah, so Tele-Well has been amazing through our clinic. And what it is it allows for the opportunity for people to utilize a platform. We utilize Lifesize. So a lot of individuals, they're familiar with things like Skype or FaceTime, or individuals who are working, they're also used to doing a lot of probably Zoom meetings. Lifesize is very similar to that. It's a platform that we will connect with individuals through a video conferencing application. So that way we still have the ability to be able to see the person on the other end of the screen and continue with therapy in what we would call the best personalized way possible right now, given the circumstances. And for folks who don't have access to the technology, to be able to download the application on their computer, a tablet, or a phone, we do offer telephone counseling as well as another opportunity for individuals who don't have that access to that technology.
Have you been seeing a little bit of more and more families using it? Because this is not just, for adults, right? This could also be helpful in those situations that we described with kids starting to withdraw.
Absolutely. Yeah, what's really great with the Lifesize is you can join, you can invite multiple people to join that particular platform. So it's not that it's just set up that it would just be, for example, myself and one other person, but we could actually invite multiple people into the room. And what's really great is, like other platforms, not everybody has to be together per se in the same household, but they could be all at different locations in different households, and everybody still has that opportunity to connect through the Lifesize platform.
And tell me just a little bit about when the last time we spoke, which was back in April, we talked about a lot of different things that could start to percolate, right, with anxiety, whether it's, related to food or substance abuse or something like that. How do you continue to encourage people, as this has gone on longer than I think people would have anticipated in mid-March, how do you encourage people, to just kind of keep persevering through this?
I absolutely say keep your connections and keep talking. Do your best to stay positive and optimistic. There is little lights of hope coming from this. But keep talking. If you're feeling something, and even when you're feeling really good, also don't, stop like connecting with people to share laughs. So it's not just about connecting with people, whether it be through an online source or a telephone call, about sharing things that are like hurtful to you or that you're afraid of, but it's also about just sharing the laughs or about sharing some really monumental things that you're learning about during this time.